Hello, good morning, good afternoon, good evening, wherever you're watching us from. This is another section of More Global Life webinar where we bring speakers around the continent who will share their experience, their knowledge over time that will benefit us. For those who are joining us for the first time, More Global Network is a Facebook community where we have young leaders in over 30 countries who believe in SDG 17. That's a partnership and collaboration to come together, to work together, to improve their personal and community development. So over time, we've been doing this More Global Life webinar where we've invited speakers across different countries. So today we have with us Dr. Azeezat Yishawu, who is from Nigeria. So shortly I'll be reading a bio, which is a profile, a short bio of her. So on this note, we always have it this way for the first time who are just watching us. We always do the introduction. From the introduction, I'll read her profile. Then after reading her profile, then she will do her presentation. Once she's done, then you guys, the viewers, will be able to ask questions. So for you to ask questions, once you're in the Q&A section, you need to drop your question in the comment box of this live video. So once you drop your question, I'll read it out. I'm supposed to display it, but presently StreamYard is having issue with Facebook. So I'll be able to read out your comment or your questions. Then she will answer that. Then we'll wrap it up. Thank you for always joining us. And thank you, Dr. Azeezat, for joining us this wonderful session as well. So on this note, I'll be reading our profile. Dr. Yishawu Azeezat is a medical doctor at Lagos State Health Service Commission who is passionate about leadership and maternal health. She is an advocate for universal health coverage, maternal and neonatal health. The co-founder of Constitution Lab, 2009.
I can't hear you again.
Lagos State Youth Parliament, International Advisory Board Member for Library Youth Parliament, Young African Leaders Initiative Network, Lagos member, among other portfolios. You're saying something? You said?
Can you hear me? I couldn't hear you for a while. That was why I wanted to call your attention.
Okay. Okay. She's a very vast woman when it comes to governance, accountability, and the health sector as well. Presently, she's a doctor, and I'm sure that's the reason why we decided to bring her on board to come and share her experience on the role of health insurance in improving.
I think we are having another network.
Over to you.
Break.
Can you hear
me? Okay. Yes.
Can you hear me now?
Thank you very much, Mr. Olatunji. Thank you for. Yes, thank you very much. Hello to everyone watching or listening to me around the world. My name is Dr. Yishawu Azeezat, and just like my colleague had said, I'm passionate about health, maternal health, neonatal health, and youth participation in government and accountability. But for the purpose of today's discussion, I'll be discussing about health and health insurance. And I would want to start from a point that I want all viewers, particularly people in Nigeria, to understand that our health is something that is very, very important to us, and we need to take up the responsibility of ensuring our health for ourselves. And I say it again wherever I can, that there is no country in the world with advanced health sector that the government is solely or fully responsible for catering for the health of its citizens. There is something that they call health insurance. So so you want to ask that, what is health insurance about? Just like any other insurance, it's the way of ensuring your health. We don't get sick all the time, but at some point in time, we will need some health care, whether through early stage in life, whether middle age, or whether late in life, or whether as a woman access to good health care, maternity health care, neonatal health care. Bearing in mind the difficult economic situations that we have in Nigeria and in most African countries, it will want us to understand as Africans that the need to prepare or to preempt for unforeseen circumstances is something that should be at the back of our mind all the time. But this is not an habit that we Africans or particularly Nigerians are trying to pick up. So, like I said before, when you look about medical tourism in advanced countries in the world, Europe, the US, they have a fantastic health system. And I can assure you that the government is not responsible for 100% of the health that is provided to people. So there's the National Health Scheme. This is the scheme or the National Health Insurance Scheme as we have in Nigeria. They're supposed to ensure people's health, whereby people are able to have certain percentage or certain amount of money set aside for the purpose of health. Now, in Nigeria, we have National Health Scheme, which was first brought to act in 2005, that was supposed to help Nigeria move forward in this universal coverage. But you will come that as years goes by, over 10 years, the percentage of Nigerians that are being covered by the National Health Scheme has dropped to a certain percent of 1.5 or 1.7%. That means that 99% of Nigerians are not under any form of health insurance. That means that a lot of people, more than 170 million people, have to spend out of their pockets. You understand what I'm saying? To procure any form of health service whatsoever that we have in Nigeria. Now, this year in 2020, we had the budget, the health budget, which was less than 6% of the national budget, as compared to the 15% that was promised about 5 years ago. Now, when the coronavirus hit us, we were all hysterical. The effect was was minimized, because the effect of the coronavirus cut across every sector, not only the health sector, the economic sector, the agricultural sector, and so on and so forth. Having worked in the health sector, we saw the backflow of the effect of the COVID-19 pandemic. We saw how our government were trying to keep up to the standard to prevent the spread of coronavirus. We saw how the government were taking from emergency funds that were outside the health sector, in order to provide temporary solutions or temporary health equipment to help curb the spread of COVID-19. And the effect of it was that when the budget was brought to the House of Assembly, the federal government cut the existing health budget by more than 40%. So this is to show that even this initial 6% that was brought up after the COVID-19, the government thought that the best thing or best idea was to cut that initial 6% by another 4%. Now, it begs the question that why do we have this kind of health system in Nigeria? We have an health system that's actually failing, and that is because there's lack of funding, just like every other sector in Nigeria or every other sector that you might have facing challenges. Now, in the health sector, we have what we call, like I said, health insurance. And this is the way in which the government itself, in partnership with the people, are able to provide adequate, a minimum standard of health care for the average Nigerian. So that means that it is not only you waiting for the government or waiting for the returns of oil money or whatsoever money, but rather you as an average Nigerian, you are putting forth a certain amount of money that would come together as a whole, whether from the government or private health insurance company, that will come together to provide an health system that will be beneficial to everybody at any point in time. Now, you may ask me that, what do I mean by this? As typically, if you are going to a general hospital or a public hospital, as the case may be, and you're going to be admitted, you spend nothing less than 30,000 naira for a stay of 1 week. You're going to pay for, you yourself, you fund your investigation. You yourself, you more or less fund your medication. You yourself, you pay for admission, being admitted to the ward, you pay for it. Now, these things are not absurd. These things are not ridiculous. They are what it is. But what makes it look like as if ours is at excess is because we do not have health insurance. When you have health insurance and already existing money set aside for it, most of the things that you do, or most of the investigations, treatment, medications that you need are already placed under health insurance. So you don't have to remove out of your money or from your own hand and then realize that you are paying for all this. Now, the advantage of health insurance is simple. The health sector needs a lot of funding. The federal government or the state government cannot keep relying on other source of income, such as maybe for Nigeria, petrol or crude oil, which has an up and down or stable returns, as the case might be. We are susceptible to global changes. We are susceptible to global policies. Today, our largest markers are largest buyers of crude oil are not buying crude oil. We still have to import petroleum at a high amount. The economy is not favorable. We have hike in fuel price. We have hike in economic goods. There is no job and so on and so forth. So how are people able to afford for an health care when they cannot even feed 3 times a day? Do you understand? And at some point in time, they would need some health care. And as someone that has worked in the health sector or working in the public, in a general hospital in Nigeria, I see people come in every day and are not able to afford, as at that moment, the care that they need. They are not able to afford the investigation that they need. They're not able to afford full medications or the best kind of medication that they might need. And though the government or the Lagos state government and the federal government at some point, they have some discount prices that they give out to reduce the price of drugs, yet Nigerians are still not able to afford it, because as at that moment in time, they do not have the cash to procure that health service. Now, when we talk about health insurance, it's just like everybody, one way or the other. For us here in Nigeria, we have Ajo, Isusu, whatever it is that we do. Some of us that buy our car, we try to insure our car because we know one way or the other, we might face some form of accident. That also applies to our health. One way or the other, in your 50, that's the average lifespan of 50 years, you would have to come to the hospital more, maybe once in a year. If not for yourself, for your family, for your children, or people that you know or close relatives. So it is only logical that we plan and we try to ensure our health, so that when you need a particular service, you are not individually paying for it by yourself. What you would do at the end of the day means that if we all, let me give a typical example. Let's say we all need to have a weighing balance in our community or in our school or in our office. And you realize that for one person to buy that weighing balance, it costs about 1,000 naira. And you know that you're not going to use that weighing balance every day. That is the truth about health. We don't expect you to fall sick every day. We don't expect you to appear at the emergency every day. We don't expect every Nigerian to be involved in an accident all the time. We don't expect all Nigerians to be in need of chemotherapy. We don't expect all Nigerians to be in need of these services at the same time. So you know that you're not going to use this weighing balance all the time. Probably you need to check your weight once in 3 months. But to purchase that singular weighing balance is beyond your singular budget. But you know that everybody in your office also needs to check their weight. So a situation whereby you now contribute money together and then buy the specific weighing balance to serve everybody, so that when we all need to weigh to check our weight, do you understand? This is actually available. You will now realize that when you ask people in your office to pay a certain amount, let's say the weighing balance is 1,000 naira, and you have 100,000 people in your office. By the time everybody is paying 100 naira, at the end of the day, you have 100,000 naira with you. Now, you will buy the weighing balance. You can even buy more than one weighing balance, and then you cannot think of other ways or other things that you might need in your office as at that point in time that would also increase or improve the health of people in the office. Then you realize that everybody have access to what they need as at that point in time. In fact, other people from other offices might not have to start paying you to make use of that particular weighing balance, that weighing machine that you have got for your office. So it applies technically to health insurance as well. Every Nigerian, as at one point in time, is paying a certain amount of money, so that when they need, let's say CT scan, some of the most expensive scan, which we know that, okay, if you buy this particular CT scan, it is able to attend to 100,000 Nigerians or 100,000 Lagosians or 100,000 citizens at the same time. But for an individual or for a company or for the government itself to procure the number of CT scans, that might affect the budget. But when there's a direct funding from the people, when people are paying regularly, you realize that when you get to the hospital, a CT scan that usually costs 30 to 35,000 naira outside, and even some general hospitals, you don't even have access to this CT scan. So you need to patronize private sectors or private ownership. And this comes actually at a high price, because these people also have to get this product outside very expensive. So you realize that this amount of money that we give out as at health insurance, that we submit to the government or whatever private health insurance scheme that we have, this serves as a form of income solely for the health sector. And this empower the government to purchase the necessary health equipment in terms of research, in terms of production, in terms of services. So in terms, it means that it is possible for the government to be able to employ more doctors, more health personnel. It also means that the government is able to purchase medical equipment. Every medical equipment is also able for government to have funding for the health sector to improve the infrastructures. So if the government is saying, okay, they only have 60% from the main budget for the health sector, the national health scheme would fund the remaining 94%. And it is possible. It is possible for the health sector, the national health scheme, to fund the remaining 94%. Maybe the remaining 60% will be meant for recurrent expenditure, while the other part that is coming from the national health scheme will be able to fund more infrastructures, more technological advancements, more research, more development in the health sector. You just put money in the health sector solely for the health sector that is being funded by the people. Now, it's not like as if we don't have an health insurance scheme in Nigeria. Nigeria has the health insurance scheme, which is the National Health Insurance Scheme, which was put into act in 2005 and made law in 2006. They're supposed to encourage people. Now, this funding is, they get some money from people, and then the government fund the other aspect of it. Now, from 2005 till now, it has dropped to only just about less than 5 million Nigerians that are being covered. And the Nigerians that are being covered are mostly Nigerians that are already working, that are are employees of the federal government. So non employees of the federal government, whether you're state government, whether you're just an average man, a vulcanizer, an artisan, you are not covered by health insurance. And when you come to the hospital or you need any form of help, then you are expected to pay from your pocket. And like I said, considering the economic of Nigeria, that is a very, very difficult thing to do. So it's not like I said we don't have an health insurance scheme in Nigeria. Lagos State also has an health insurance scheme. Then it begs the question that why aren't Nigeria, why is it that up to 95% of Nigerians are not covered by any form of health insurance, whether it's from directly to the government or a private sector? Now, one of the things that we figured out for those of us that take our time is that we have the issue of accountability and corruption, even in the health sectors. So the National Health Scheme itself is not being monitored. There's not a monitoring and evaluation team that is independent of the National Health Scheme itself that take up data to assess that, if the health scheme is saying that this is the amount of people, or other private partnership that, okay, this is the amount of people that we've through the National Health Scheme, we'll be able to pay for their health bills, we'll be able to cover this type of thing. You understand? There's no accountability there. A lot of funding are being swarmed up. A lot of ghosts, just like we have ghost workers, we also have ghost people that are on the National Health Scheme that are not being accountable for. Another thing is what communication and sincerity on the part of the government. A lot of people don't even know what health insurance scheme. They've never even heard of it. And as a government that is committed to the people and is committed to development of any sector whatsoever, it is part of the national, we have the National Agency for Communication, or is it information, to pass out this information to the people, to know the importance of this particular information. Now, just like every other country, before you do some certain things, you must have a tax, a social security number. You must have, if you are working, you have a tax ID. For you to access some certain things, you must have, they made it mandatory that you must have some form of insurance ID. So this is the government that is committed. The same way applies to a government that sees the benefit of ensuring that every Nigerian, no matter the level of education, no matter the work that you are doing, that what you have a form of insurance. So whether it's by punishment in the absence of such insurance scheme or reward in the presence of such insurance scheme, the government needs to be committed to ensuring that every Nigerian or every citizen of their state has a knowledge and is one way or the other has an health insurance scheme. Now, another aspect also is what? Penetration and bringing down the information to the local level. The advancement of technology, Nigeria is still way behind in the advancement of technology, in the advancement of internet, of every other development that we are seeing around the world. But it does not mean that we don't have an existing system that can capture everyone, into the health insurance scheme. Like I said before, there are some already existing financial kind of system that already have this local among people. So for us, we have things like Ajo, we have things like Isusu. So people already know how to save up for a particular thing. And they have a way of ensuring that their money gets back to them. Whoever it is that is collecting that money gets back to them. So what the suggestion or what the government needs to put into it is that they need to tap into already existing local financial system that would ensure that every Nigerian, whether it's Yaloja, because people say that not everybody has a bank account, not everybody did this, one way or the other, you would believe me, or you wouldn't want to believe me that your Pepe woman has an account one way or the other. You understand? Depending on what the benefit that they are getting from the bank and how important they realize what it means to have their money in their account. We know that having an account with the bank gives you access to loan and so on and so forth. So more like a perception that Nigerians will not, you understand, will not be able to do that. It should not be something that should be encouraged. And even at that, with people that do not have bank account number or stuff like that, they already have an existing financial system. That I think that a government that is sincere and is committed to ensuring that, okay, we know that as a government, we cannot fully, it's a lie, we cannot fully be responsible for financing the health sector. Then we need to go into a solution that is worldwide and is working, and that is the health insurance scheme. So they need to bring it down to the local level. They need to bring it down to the people in their language, in a system that they recognize. Now, while all this is going on, we always talk about corruption, we always talk about accountability, and that is when the people come in. While the people a lot of people are discouraged about partnering, let me put it in quote, partnering with the Nigerian government or any form of government in Nigeria, is the issue of accountability and the issue of transparency. And that is what democracy is all about. And people don't need to be have degree in university to understand the process of democracy. You don't need to have a master degree, you don't need to have a BSc, you don't need to be a sophisticated person with a proficiency in any language for you to understand the basis of accountability and what democracy can provide. So if the discussion is about the Nigerian government is corrupt and stuff like that, we have part of the constitutions, we have laws that have been laid down that would ensure, and the purpose of democracy is that the people are being served, the people are being services. The dividends of democracy is being delivered to the people. And when people are being educated about their civic responsibility, then they know the importance of asking questions, of following up and requesting for accountability. And this is mostly done through the representative that you have either at the state level, at the Senate, or at the House of Reps. So while the standing challenge that we have about government accountability and transparency, the idea of an health insurance scheme should not be rubbed off. I have talked about the advantage of it. It puts a lot of money in the health budget. It allows whatever health services, whatever health project, whatever health infrastructure that would usually not allow the federal government be able to carry out because of the different aspects of the budget that is involved. You will now realize that with the health insurance scheme, the people themselves are the one funding the health of the nation. And this would also allow other investments, other partnerships from other countries. We can even be having medical tourism here in Nigeria. I give a typical example of India. the Indian is known for so much orthopedic medical surgeries, and even a lot of transplant surgeries, because they give out, they more or less provide these services at a discount rate compared to other countries. And this is because there's a lot of funding already in the country that allows the health system to procure whatever it needs to carry out such surgeries or such widely accepted life-saving surgeries. So that also applies in Nigeria. It also can also serve as a form of income through medical tourism. By the time we have the development, we have the equipment, we have the technology, we are at the forefront of research. You understand? Which are all the things that need funding, which are all the things that need a lot of money. So by the time we are at the forefront of it, it is easier for an average Nigerian, no matter the socioeconomic background, to access an average health service that would ensure a certain amount of money, that would ensure easy access to investigation, that would ensure that doctors are available to attend, that will also stabilize the health sectors, that prevent a lot of coming strike there, industrial strike here, and all these kind of discrepancies that we see that more or less slow the development of the health sector. So I think I'll put a pen here. I'll have to stop here, and I will take any questions from the viewers. I think we spent about 26 minutes. So Musa, back to you, please. Hello.
Thank you very much for the wonderful presentation. We really appreciate you for the insights you've shared so far concerning the health sector. So on this note, we are on the question and answer segment. So if you have questions or comments, you can kindly drop it at the comment box. I will display it, then she will answer the questions or your maybe whatever comment or suggestion you have. So while we are waiting, let me try and display some of, while you're presenting, there are some comments I want to try and display for you to see.
Okay.
Though their names and picture will not be displayed because they didn't give StreamYard access to have their photos.
Facebook
and
didn't. Okay. All right.
Okay, this one is coming from, let me check. This particular comment is coming from, okay, Peter. It's coming from Peter. And there is another comment as well. This is coming from Muhammad, Alpha Muhammad. Okay, while we are waiting, you are in the question and answer segment. So if you have a question, you can drop it. And for those who might not be watching us live, who will be watching the replay, you can always ask your question. Then I will definitely tag her on this post so that anytime she sees it, you can definitely answer it.
I'll make sure to do that.
Okay. Okay, you can see
Peter.
This is one of the...
Yes. Yes, I can see Peter. Thank you very much.
I hope I'm allowed to ask you a question.
Yes, definitely, because I wanted to continue. I was just looking at my time so that if viewers were to ask me questions, then I could continue on, on our discussion, because I wanted it to be as much as possible discussion rather than a one-side presentation.
No, you can, if you still have much more information to share with us.
It's just more of a discussion, because I know that a lot of young people are not concerned about their health. And they are not looking at the future, which is something that we young people in Nigeria ought to take note of. You understand what I'm saying? And myself and my team, at the end of this month, 30th of September, we're organizing a Lagos Health Summit, which is focused on health insurance. We are getting stakeholders, both from the government and the private sector, to discuss how we can make more Nigerians aware of the health insurance and its benefit, what it means. We as Nigerians, we cannot deny the fact that we will fall sick one way or the other. And as at that time, we may not have the $10 million, $10 million in our account, or the loud spending money. You understand what I'm saying? And a lot of people have died because they have not taken care or thought about their health. Every day, I lose a patient. Every day, I lose a patient from road traffic accident or medical causes. I treated the patient for about 2.5 months. The people, the family were committed. But eventually, they ran out of funds because the funds they had were funds at hand. You understand what I'm saying? And so eventually, they got tired. They couldn't maintain the type of antibiotics that we wanted. We had to go down to a lower grade, and then eventually we lost the patient as well. And there are a lot of things in the health sector that are not working. You understand? They are not working, and they are not things that are absurd, far-fetched, or meant for a certain kind of people. In Nigeria, we've come to realize that we don't run a system kind of government. We run a person kind of government, whereby, when somebody comes, it is the agenda of such person that we would try to drive for the next 4 years, and if we are lucky, for the next 8 years. And then when somebody comes in, whether it's from a different political party or the same political party, they tend to write off whatever has been known, whether it was good, whether it was not so good. They don't want to know, and then we use the same fund to start afresh. And we also realize that the plan, even in the health sector, you understand, the agreement as at I think 2010 or so, was that when the United UNICEF and WHO agreement came with that, okay, at least we should be able to make the national budget health be 15% of the national budget. And this is us 10 years down the line. We are still less than 6% of the national budget to care for over 200 million people. And one thing I tell other people is that the population of Nigeria is its natural resources. It is generating. We're a large number of people that is resilient and persistent. So what we need for is that we need further thinking. We need to preempt. We need to prepare for that. COVID-19 was here, and I knew that it had its toll on Nigerian economy. It had a toll on the government. We had a lot of international support. We had a lot of international donation and so on and so forth. Despite the fact that we did not face the COVID-19 as much as other European countries. And most of what we were doing from the health sector was response. We didn't have enough doctors. We had to get different set of doctors that would be at the ICU centers. We did not have enough ICU centers in Nigeria as a whole, even in Lagos State, that we ought to start having temporary ICU centers. And then the government started bringing in private hospitals to take up the management with the management protocol. So we were just reacting. And you can imagine if COVID-19 has hit us the way it has hit the European country. They already have an health system that works. You can imagine the number of the catastrophic effects that will have been on the health sector. And you would agree with me that even all the amounts that have been spent for COVID-19 are temporary. It did not bring about more employment of doctors. It did not bring about more infrastructural development. Everything that was spent on COVID-19 in the health sector was just temporary, which would eventually, the camps that were set would eventually be packed up. Whatever machines that were put up or beds will eventually be packed up because there's no even space to put those beds. There are not doctors to attend. The COVID-19 did not make the government see any further. So that is why I'm always particular about having what is the quality of the average Nigerian. What is the average Nigerian thinking? Is he able to ask questions? And he does not have to have a degree to be able to ask questions. So when the people are interested also, they are able to push for what they desire from the government. So I think I would leave it here. So if there's any questions that I can answer.
Okay, I really love the way you put this particular section. The question goes back to the citizen. Yes. What are you doing? What your responsibility, your rights? How are you demanding for it? Because that's the question I actually wanted to ask you, because I know you are a strong advocate when it comes to SDG3. As a practitioner, you're also part of the advocacy team. So, and during my course of doing internship at the National Assembly, while they were trying to pass a particular bill that relates to health insurance or so,
Yes, 2019.
I understand, yeah, I understand there were a lot of controversies going on in the House, which I'm not allowed to say on this particular platform. But as a doctor, I think you've actually mentioned some of the key aspects of it. You talk about the accountability and corruption going on in the system. And I think it's not just in the health sector as well, but because we are focusing more on health sector today, so I think let's just limit it to that particular aspect. So my question is, as an advocate, what do you think we can do as an SDG3 advocate? So I'm trying to speak for the SDG3 advocates. What do you think? What do you think they can do to make this work?
Just like you said, a crucial or important part of advocacy is changing behavior and orientation. So it's when you are telling some people that this is what works, this is what is best for us, this is what we can do. So in the aspect for those of us that advocate for SDG goals, SDG3 and other goals, I used to say that as people or as activist groups, what we can do is always clamor for it. I will say it again that the government itself is the platform that can affect the biggest change to any citizen or in any country. As the government has access to large number of people. The government can take care of large number of people. How many private insurance company want to take up the health insurance for Nigeria? If the health insurance in Nigeria is still unfavorable, just like every other aspect in Nigeria, the cost of health will still be high. People will not be interested because private sector are more interested in profit. So what are the policy that Nigeria is putting into place, the government is putting into place to encourage these people? If there is no funding to the health sector, you understand what I'm saying? It will be difficult to purchase it. And let us start with equipment. Let us just start with diagnostic equipment. A CT scan, an MRI scan, an X-ray scan, laboratory reagent, laboratory items, as simple as a sample bottle. We don't even make a sample bottle in Nigeria. To take samples, we don't. There's no funding, but this is an aspect of the health sector. If there's funding in the health sector, and then we decide that, we would make these sample bottles and then distribute to other West African countries. But if we do not have the massive funding that we need to even take initiative to production, you understand what I'm saying? Then you can't have any development. And this all boils down to, we are all waiting for the crude oil, the petroleum oil. That is not only. And the good thing about the health sector is that, compared to other health sector, you pay food insurance. I don't know whether you pay food insurance or something like that. One thing with health sector is that even compared to other insurances that you have, you understand, health sector gives you immediately more than what you even paid for. I gave an example of the weighing balance. A weighing balance costs 1,000 naira, and you paid 100 naira, and you can come once in 3 months to measure your weight. Do you understand what I'm saying? So, unlike health insurance, that is the amount that you have in your account, and then so you sort it out with your insurance company, and then you have to pay back. But in health insurance, there's really nothing to pay back. You understand what I'm saying? And not all Nigerians is going to fall sick at the same time. It's not everybody that's going to have Okada accident or have a road traffic accident. As at that point in time, what the person needs when they come in is a theater. Let's say a very bad road traffic accident, patient is bleeding, he needs to be in a theater. They can only be specific. That is infrastructure. You don't need. It's not a recurrent expenditure. So once you have a standard theater, that person, let's say the insurance of that person is probably 1,000 naira a year. The person is going to have access to that theater. You need a surgeon, but let's say we've had adequate number of this thing. If you are going to pay me as an individual in my private firm to carry out a surgery for you, you'll be paying hundreds of thousands of naira. But a situation where you have an health system, you're only going to pay one doctor. because a lot of Nigerians have already contributed that 100,000 naira, and you can even pay that doctor the amount that is worth it, because all of Nigeria, let me put it in an hypothetical ideal state, all of Nigeria has contributed money for this particular health person, whether it's the health professional, whether it's the theater nurse, whether it's the casualty doctor, whether it's the other health professional, so that the laboratories, the pharmacist, the technician, the scientist, the other health professionals that you have working in the hospital. Do you understand what I'm saying? The whole of Nigeria has actually paid this person. So as at any point in time, you have access to that same grade of what? Of service, that same standard of health service. So if a patient comes in and they say, so there's nothing like, oh, you have to pay for the surgery. The surgery is something amount. You have to pay for theater. The theater is something amount. You have to pay for the drugs that they're going to give you in the theater. It's something amount. You understand what that is? So you yourself funding your health as at that point in time. But with health insurance, this person is already on a form of health insurance. With the amount of funding the health insurance, the government can purchase the drug in large amount of quantity and at a discount price. The country can purchase those health equipment and diagnostic equipment in large amount of quantity and in discount price. You know how it is in Nigeria. The more you buy, the lesser the price. Do you understand me? And the more you get. So that's how it applies as well. You understand what I'm saying? But we need the people to be willing to contribute. We need a government that is accountable and transparent. And I tell everybody at an end point in time that government all over the world do not want to be accountable. It is the people, it is the system, do you understand, that brings them to account. You understand what I'm saying? Since Trump got into the government, he's trying to pull off some of the system of some of the programs that the Obama had put in, so that the Obama care, even some of this international youth development for Africa, he has been trying to put an hold on it. But because there's a system already, there's already a system that works, then it is hard for anybody with any ulterior motives or even or motives that do not align with the dream of the American people to come and change. You understand what I'm saying? So it also applies to us as well. We as Nigerians need to change our orientation. That is what advocacy is about. We need to change our thinking. We need to know that we can affect the government, we can determine the government, and we can all, as a whole, be beneficial to one another. So I think there's a question from Peter. Okay.
That's the question.
Yes. How can the youth of this generation participate in this campaign? So many are stranded in the office without attention. What can we do to save such life? I think that the first thing to do is that if you are stranded in office and you are campaigning for, or you want to be campaigning for any form of advocacy or interest, I think that the first thing that you should do is you in your office find out what health insurance are available. As part of the Nigerian Health Act and other provisions, if you are working at a private company, your company is expected to provide an health insurance for you. So I think that your advocacy can start there. You can ask the questions from the management. Do you, as an employee of this government, have access to any form of health insurance? Do your colleagues have? If your company does not have you sought out for an health insurance yourself? There's some health insurance. Okay, coming up, like I said before, we have a virtual health summit. We already have some private health insurance that you can pay as low as 1,000 naira per month as an health insurance, and it gives you a particular bouquet or this thing that okay, you'll be able to have access to setting this, and setting this. So if you're a family of 5, this is kind of plan that you will take that will benefit you, and these things should be able to take care of simple surgery, simple hospital admission, pregnancy, delivery. Do you understand what I'm saying? Neonatal period and so on and so forth. So it should be able to provide for such. So for you, you can start with your office, you can start with your school, you can start with wherever it is that you're working. And if you're an individual or for now you're still an individual, then you can sort out existing health insurance scheme, and even the national health insurance scheme itself. According to the national health insurance scheme, every Nigerian is entitled to, I think, less than 3,000 naira as an health coverage per year. So I don't know what you are going to use the 3,000 naira to do. So I think that's what we have, and it's not quite impressive. And I think that we can do more, because we are a country with large number of people. We just need to improve on the quality of Nigerians. When I say quality, you mean that, okay, if an average Nigerian is standing, whether it's from Mushi, whether it's from Banana Island, he knows what government is, he knows what government processes, he understands what democracy is and how democracy can benefit him and multiple other people. Democracy that we practice in this, I don't know whether it's Nigerian version, you understand? But so that when they stand beside somebody else, somebody in Mushi knows that, oh, if I were to do an health insurance, I will benefit from somebody that is in Banana Island. Because eventually, when I approach a government-owned hospital, I would get a standard healthcare service. So I think that's that.
Okay, thank you very much for the insightful information. I've been able to jot a lot, and I'm thinking, so which way forward, and which you've shared different tips and different strategy where we can make it work as an advocate, as a citizen, even if you are not an advocate, as a concerned citizen, even if you are not a concerned citizen, even if you're selfish yourself as a person who is living in the country, your responsibility, your role, your role. So looking at the whole situation, while we are still waiting for any other further question. So while we are waiting, I am someone who likes to ask questions as well, because health is very important. So looking at the health sector and what is going on presently right now, and because what interests me most is, for every system to work, there must be accountability and transparency.
Yes.
So, and you've made mention of the parastatals that are involved, and the scheme, the association, and sort. The likes of the, what's it called? The likes of the practitioner. What are they actually doing? Because you guys are the receiving end, aside from the citizen. Because you as a doctor, you will not feel good looking at your patient dying, and you know there's supposed to be provision for such what's it called, patient.
Yes, for my kind of personality, I think that I've gone through a lot of emotional trauma since I particularly started my surgical posting, and I've practically seen someone die every day, and not for impossible reasons, you understand? When we talk about humanly impossible, Nigerians are always so religious, and we do not know that God has given us a lot of responsibility, and that the things that are left to God are small, you understand, in our lives. So when we talk about humanly possible, we are yet to grab the scope of what that is. And as an health practitioner, I think that just like every other thing that we do in Nigeria, we still need more to do. And that comes to health practitioners. We have a lot of medical bodies in Nigeria. We have the Medical and Dental Council of Nigeria. We have the National Medical Association of Nigeria. We have Association of Resident Doctors in Nigeria. We have a lot of medical organizations that are in states all over Nigeria. And, when we call for strikes and all those actions like that, and they are the ones that seems to be representing the interest of doctors, and by extension should be representing the interest of their patient, and that would mean every Nigerian concerning the health sector. So for me, I think that this association, this group are not yet playing the role that will propel the health sector that will propel us forward. I don't think so. I don't think that we are sitting down at the round table to ask questions, to provide solutions to problems. Yes, because government does not know. When I say government, I mean government officials. Do you understand? They don't know the happenings that they don't know what happens every day. And the things that government work with, one of the things that they work with is data and statistics. And while they might have their own employed people to collect data and statistics, I believe that organizations that are inclined towards Joesu, other health organizations, we have those for pharmacists, we have those for nurses, let me not mention just doctors alone. We have pharmacists associations, we have associations for nurses, and we have positions for laboratory scientists. We have those that do not even, that are not doctors but work, in the health, whether as cleaners or as caregivers. Do you understand that we have associations for these people too? So they need to be at the table. They need to be speaking to the government. They need to participate in the government. I don't know how many budget passing process that any of the association has been to. I don't know how often we've written to the chairman of health committee. I don't know how much we've written to the commissioner of health. I don't know how often we've openly questioned the selection of members of the cabinet in the health sector. I don't know how often we've questioned the actions and the decisions of commissioners or ministers or staffs that the government or the president or the governor has elected in the health sector. That aside, also, we've also done little to create awareness with our patients, to mobilize, to advocate. For example, I myself on a personal level, each time I manage a patient and they get well, then I talk to them about health insurance. I'm like, you can see how difficult it is for you to pay for your bills and get out of here. Have you thought of health insurance? Do you know the importance of health insurance? Do you know how it will benefit? Do you know how less stressful this is for you? Do you know that when tomorrow night your child might fall sick, then you've just paid this large amount of money? So as health institutions, as health organizations, I don't see them doing that, you understand me? And I don't see that advocacy, even for our patient. Just a lot of crying once in a while when it's so hot, you understand? Then we're talking about this allowance, increment in allowance. What is so much about increments in the payment of the Nigerian doctor when you cannot afford what is basic? You understand? Even yourself as a doctor, you don't have health insurance. You understand what I'm saying? Even yourself as a doctor, you don't have health insurance. So when you also get into an accident, you are coming to face the same challenges as well. So it begs a lot of questions, and I put it to them whenever I have the opportunity. What do you do? How do you sit on the decision-making table? Do you know about the budget before it is passed? Do you know about what the government are decided to do in the health sector before they submit it to the National Assembly or to the State Assembly? They said they are going to build 10 primary health centers. Is that what we actually need in the health sector? If they said they were going to provide, I don't know what it is, you that have access to information and data, have you put it to them that this is not what ought to be in the budget? And this association is supposed to be independent of the government. So they're supposed to serve as the community that seeks for accountability and transparency. They're supposed to be part of the people that seeks for accountability and transparency. While the government would always be government, would always do what they want to do, is these associations that their interest should go beyond personal progress, or they should not be deterred by threats or whatsoever that it might be, but that they should know what their full responsibility is as an association that is not only representing doctors but also representing representing the patient. And like I said, the government will not really know what it is that you need until you provide with them. And even sometimes they may have a problem, they might not know the solution, but you are in those problems that have access to direct information might have the solution. Then it is time for you to table such solution to the government and press for whichever democratic process that allows you to ensure that that solution is implemented. So I hope that was sufficient.
Yeah, thank you very much for responding to such question. This is a comment from Peter, who has a question earlier.
Okay.
Okay. And I think we have a comment from the speaker, Gombe. That's the present speaker of Gombe Youth Parliament.
Good afternoon.
Thank you all for watching.
Thank you so much.
It's been a journey. It's been
Thank
a
you very
journey,
much.
and I really appreciate all the information you were able to put out, and the call to action as well. That's the most important part, because we've been complaining as a citizen for many years, and what has been changed? Nothing. Some people are complaining, why some they just feel they are less concerned, not understanding that everything that happens in a particular environment that you live, you eat, you work, everything concerns you. So as a citizen, we have to be passionate. We need to understand our role. We need to understand citizenship. We need to understand our responsibility. It is time we need to start asking the right
Absolutely.
questions before we can even demand for accountability, transparency, or sorts. If I'm wrong, you can let me know.
I think that when people ask questions, then they're already asking for you to be accountable. And like I stated before, that the average Nigerian now is yet to understand why you should even ask questions or how to ask questions. They don't understand what democracy is about. They don't understand the process of democracy. Just like part of the things that I do is constitutional literacy. We want people to know that when a policy or a law is being enacted or announced, it didn't just come from the blues. There are process, up to 7 process for this law to be what? To be enacted and passed, for this bill to be passed into law. There is bounding on all Nigerians. There's a law now by the federal government that allows the police to arrest anybody based on suspicion. And I know people will be like, oh, how did it happen? How did it happen? It did happen. And it did pass through the process. Now, when we talk about political interest, we know how maybe a government might not relay a particular information as early enough, in time enough for people to react. That is why the people need to be up and standing. That is why we need other advocacy group to also keep their ears down and be at alert. I believe that when the social media bill came up, we saw how Nigerians reacted to it. And so, and some other bills that were coming up, that we need to be. So the average Nigerian needs to know that when they're talking about this, he knows that one way or the other it will impact his or her life, then he is actively involved in that process, whether directly or indirectly.
So thank you very much. I think it is almost time, just 3 minutes to end this session. It's been a wonderful session with you, Dr. Azeezat.
Yes, thank you so
I'm
much for
hoping
having me.
maybe when next we invite you, you come and share more insights and what you've been able to do with your office, with the Constitution Lab as well.
Yeah,
I know you're busy, you are presently at work, so we'll allow you to go now.
thank you so
But thank you
much.
very much for appreciating. Thank you very much for coming us.
Thank you
Thank
so
you
much
very
for
much
having me.
in our request to share this wonderful information. So, like she has said, the question goes back to the citizen and even the doctors as well. As the citizen, what are you doing in your own corner to ask for accountability, to ask for questions? So, on this note, we'll be saying goodbye to this particular section. We'll see you next week for another section. Thank you always for joining. Thank you very much. See you. Bye bye.